What seems to be the problem this time?
Patient in room 31B needs a lab done. They contracted some unknown infection and the symptoms are getting worse.
What exactly are the patient's symptoms?
Some of his symptoms include chest pains, fatigue, and chills. He also has red bumps on his body similar to a spider bite.
Do you have any tissue sample ready?
Yes, I have it.
It's going to take at least 2 to 5 days to identify the culture. Will the patient even be able to survive that long?
I'll get some nutrient agar right away.
The patient seems really sick. They just came from hip replacement surgery, but this infection was post-op and is making their condition worse.
Don't worry, we'll get to the bottom of it as soon as we can.
We are MBI.
Okay, just send the results. Weirdos.
Dang, I was hoping this was going to be an easy day.
After completing a gram stain test, it appears to be gram positive. The bacterium is also cocci.
While you were doing that, I completed a motility test and it is non-motile also. This thing seems to be resistant to oxacillin and methicillin.
Oh shoot, it can't be.
What is it?
I forgot my lunch.
Oh my god, what about the bacteria?
It's probably antibiotic resistant. Let's just run a couple more tests.
Hey guys, did you say it was resistant to oxacillin and methicillin?
Yeah, why?
Doesn't that automatically mean it's MRSA?
Let's see if it's resistant to erythromycin.
Yeah, that way we can determine whether or not this infection can be acquired throughout the hospital.
Beep, boop, boop.
Well, it is resistant to erythromycin too.
Let's call this nurse before it spreads to more patients.
Hi, I've been calling you for hours. Is it figured out yet?
Yeah, it's hospital-acquired MRSA.
More patients have been showing similar symptoms. How do we stop the spread and treat the infected patients?
Wait, hold on. Can I put you on speaker?
Yeah, go ahead.
Well, first, everyone needs to be washing their hands properly. We also need to wear protective garments before dealing with any of the infected patients.
Then we need to determine if anyone has any MRSA colonization.
Okay, got it. I'll call you back in 5 minutes to talk about the treatment.
So, how does the infection and colonization even occur?
It's a long story, but I guess we have time until she calls back.
The root cause for antibiotic-resistant bacteria is due to years of using drugs that are unnecessary for treating certain illnesses, such as the common cold.
We need to tell all hospital staff that they need to look for any skin infection that can indicate infections such as boils or red bumps. However, colonization is when a person carries MRSA on their skin or in their nose. However, them themselves aren't sick. Having good personal hygiene helps reduce the risk of transmitting the disease.
Unlike you. Because MRSA has infected the patient's bloodstream, we need to use intravenous antibiotics.
What about the other patients?
Well, after examining them, their symptoms are less severe compared to the patient in room 31B, so I believe that they can probably get better through prescribed oral treatments.
Can this infection be contracted by air?
Hospital-acquired MRSA are generally contracted with hand-to-hand contact. Although infection can be contracted through air, it is highly unlikely.
Well, is there anything we can do to stop this spreading to other patients?
After placing them in isolation, inform every staff member in the facility that enters any patient room to dispose of the gloves that was used in the room immediately upon exiting. They should be using a clean pair of gloves every time they enter a room. This step must not be avoided because this is mainly how this type of infection can occur. If anybody has the slightest feeling that they have a cold, have them put on a mask. It helps protect the spread of other infections on top of another.
Also, when the cleaning staff is wiping down each room after the departure of each patient, they need to be thoroughly sanitizing everything in the room that may be touched, such as sink handles, beds, remotes, and door handles. It is possible for patients to catch an infection from the previous patient in the room.
And we can't forget to thoroughly perform stricter hand washing procedures and proper laundry cleaning.
Okay, we've done all of that, but how do we now treat those that are infected with the virus? We can't just keep them in isolation for forever.
Depending on the strain of the hospital-acquired MRSA, different types of antibiotics may be used, such as clindamycin, tetracycline, vancomycin, and others.
Do we know which strain of hospital-acquired MRSA is going through our facility?
Our assistant is checking now. We should be able to classify which strain it is after analyzing it further.
We concluded it is MRSA 1. It seems that since the introduction of methicillin, other hospitals have noticed frequent MRSA infections also.
That is because overuse of antibiotics cause Staphylococcus aureus to mutate target proteins and the accumulation of antibiotic-resistant conferring groups from other bacteria through horizontal gene uptake.
Shall we treat the patients with vancomycin?
That's probably the best bet that we have right now.
But won't the same thing happen with a new antibiotic?
Yeah, it's possible.
We have reports from families that their loved ones are in isolation. Can you tell me what is going on and if we should be worried as a community?
Well, a bacteria called Staphylococcus aureus has become resistant to the conventional antibiotic methicillin, and outbreaks have been occurring in our hospital. There is nothing to worry about though, as we are conducting procedures to contain the outbreak. The use of vancomycin looks promising in treating patients with MRSA.
Other hospitals have also reported outbreaks like this one. Is this the beginning of a global plague?
Although MRSA outbreaks have been occurring globally, it has not reached the community. It is predominantly in healthcare facilities, and we are working hard to keep it under control.
So the outbreak of infection was indeed MRSA, which is caused by the overuse of the antibiotic methicillin. But the development of a new antibiotic called vancomycin has led to a new antibiotic-resistant strain known as VISA. The initial resistant strain of MRSA that emerged in the 1960s and lasted through the 1970s is known as the second wave of resistance and largely affected European and the American hospitals. By the 1980s, MRSA resistance had disappeared for unknown reasons, but reappeared in the mid-1980s. MRSA lineage strains had emerged across the globe and continue to this day to plague hospitals and long-term healthcare facilities. MRSA continues to mutate, causing the new strains to become more and more resistant. Each year, more than 90,000 Americans are infected with MRSA, and 20,000 die in hospitals and community settings. As the biologist in the video had mentioned, hand and environmental hygiene are critical to limit the spread of the infection, as well as patient isolation and hospital staff decolonization.
Guys, I figured out that it was MRSA and you didn't even invite me to the press conference.
You're fired. You have open-toe shoes on.
That's ridiculous.